MFA updates.
Sawadika and welcome to MFA Update, a weekly program that focuses on Thailand's international affairs and activities. I am Kimmy or Kim Paniknita Grairok, your host. Today we welcome Kun Chanitnath Yankitikun, attaché from the Thailand International Cooperation Agency or TICA. She will inform us about TICA's development diplomacy in public health during the COVID-19 era.
The Foreign Affairs that matter. Special guests from the Ministry of Foreign Affairs. This is the MFA Updates.
Hello, สวัสดีค่ะ คุณชนิตนาถ
Hello, สวัสดีค่ะ
Glad to talk to you.
Glad to talk to you too. Thanks for having me today. My name is Chanitnath Yankitikun. I am an attaché at Thailand International Cooperation Agency or TICA, Ministry of Foreign Affairs.
So, what is TICA and what are the roles of TICA on development diplomacy?
Well, about TICA, many people might not be familiar with TICA or Thailand International Cooperation Agency, and perhaps think of it as a brand new department under Ministry of Foreign Affairs. But TICA actually has a long history dated back 50 years ago. It was established in 1950, originally as a receiving committee to administer projects relating to the U.S. President Truman's initiative and to facilitate technical and economic assistance received from foreign countries. And then, in 1963, the cabinet upgraded the committee to the Department of Technical and Economic Cooperation, or DTEC. And for 30 years, DTEC was part of the Office of the Prime Minister. Fast forward to the more recent time.
Okay.
As Thailand gradually shifted its role from the aid receiver to the aid provider, DTEC was then transformed into TICA, Thailand International Cooperation Agency, and was eventually integrated into the Ministry of Foreign Affairs in 2004. And ever since, international development cooperation has become a part of Thailand's development diplomacy. Now, TICA's mission is to propel this development diplomacy. We implement development cooperation projects bilaterally, trilaterally, and multilaterally with foreign countries, intergovernmental organizations, regional organizations, international NGOs, and also other relevant international entities. We also provide advice on government policy relating to development cooperation. But TICA aims to undertake development cooperation according to the government's foreign policy and foster good relations with the foreign countries, especially neighboring countries.
Okay. So talking about the COVID-19, how the COVID-19 pandemic has affected the implementation of development cooperation and how TICA responds to this difficult time.
COVID-19 has been very challenging to us. Before anything else, I have to say that TICA has been implementing development projects in various sectors, ranging from agriculture, labor skills, trade, education, public health, and so on. And each project comprises of a set of activities. The variety of activities are assessing feasibility, providing scholarships, organizing on-site trainings, dispatching Thai experts from different fields, or even providing necessary equipment and constructing hospitals and school buildings, and so many more. And indeed, international travel is strongly required to implement all these projects that TICA has across the world. And however, this unprecedented pandemic that comes with travel restrictions doesn't make our lives easy at all. But instead of giving in, we have tried to adjust ourselves and make do of what we have. Well, as much as COVID-19 disrupts TICA's conventional work, it is undeniably a catalyst for digital transformation that, in fact, accelerates a lot of processes along the way. New normal activities have become mandatory for us in order to actuate our ongoing projects. Everything that used to be undertaken on site becomes online. In-person meetings become Zoom and WebEx meetings. Seminar becomes webinar.
Yes.
Yeah, and of course, this has been a very difficult time. And as a matter of fact, many activities, many projects have been put on hold indefinitely. Nevertheless, we wish to keep on trying to find the best solutions and ways to achieve our goals, as well as to come up with new initiatives that can respond to COVID-19.
What is the development cooperation initiative of TICA during the COVID-19 pandemic?
Well, with this very recent pandemic of COVID-19, as a development cooperation agency, we have been put to taste on how we can help each other in times of health emergency and what we can do to provide the most effective response. Well, we recognize that there is a need for international cooperation to combat this pandemic together. Since March 2020, after close consultation with our partner countries such as Myanmar, Laos, and Cambodia, TICA, together with the Ministry of Public Health, has launched the Development Cooperation Program between Thailand and neighboring countries on strengthening preparedness and response to the pandemic of COVID-19, with the objective to improve our partners' preparedness and response, and to ensure their prompt public health measures, and also to share knowledge and lesson learned from the frontline management, patient care, and the prevention and the control of community spread. This project has 3 phases of work plan based on the outcome expectations of each work plan, namely short-term, medium-term, and long-term. Well, for short-term, we focus on sharing experiences and transferring knowledge regarding COVID-19 in both clinical and public health aspects through a series of webinars and online medical consultation, which we received very good feedback for these activities. We even extend our cooperation on COVID-19 knowledge sharing beyond neighboring countries, such as South Korea and Peru. The last webinar that we just organized with Peru had over 300 participants who are healthcare professionals. And as for the medical consultation with our neighbors, which was also successful, we could then identify our partners' needs, including technical assistance for personnel and provision of medical equipment and other supplies. And in addition to this, TICA also created an online knowledge sharing platform called TICA's Knowledge Bank on COVID-19, which features a wide range of topics on public health and clinical responses and the management of COVID-19. We even have the YouTube and podcast for this.
How about the medium term?
Yeah, as for medium-term work plan, we focus on improving medical and public health preparedness by supplying necessary and urgently needed medical equipment, such as PPEs, oxygen concentrators, blood gas analyzers, pulse oximeters, favipiravir medication, just to name a few. Well, TICA also provides training for capacity building for the usage of all this equipment through online medical consultation. Furthermore, in the medium-term work plan, we also provide trainings for field epidemiologists to strengthen the capacity and prepare Thailand and neighboring countries for future emerging diseases. This year, we just have a medical doctor from Myanmar who is currently attending the International Field Epidemiology Training Program organized by the Department of Disease Control.
Oh, I see. And for the long-term work plan, please.
And lastly, the long-term work plan focuses on enhancing microbiology laboratory capacity for virus detection. We realize that early detection is very important, and it will prevent rapid spread of COVID-19 and will allow the recovery of cross-border trade and transportation to go smoothly. TICA then provided and set up a GPCR laboratory equipment package with SARS-CoV-2 test kits to 6 locations in total which are Private Referral Hospital in Cambodia, Bogao Hospital, Sayaburi Hospital, and Kangwon Hospital in Lao PDR, as well as Myawaddy Hospital and Yangon National Health Laboratory in Myanmar. Still, we are planning to extend this support to other border provinces in the future.
And is there any uniqueness about Thailand cooperation to combat the COVID-19?
Yeah, there is. I think it's just important to take advantage of challenges and crises and turn them into a unique set of knowledge. Well, in reality, developing countries often face budgetary constraints. The truth is you do not need ultra-modern technology to provide people with primary health care. The truth is sustainability can simply rely on having managed knowledge and know-how in front of you. It is all about knowledge management. One example is Thailand's government pharmaceutical organization, or the GPO, which is a state enterprise. GPO has invested in the research and development of their own pharmaceutical products and medical supplies to become self-sufficient in the production of medicines and rely less on imported drugs, such as favipiravir, which is Thailand's main medication for COVID-19, and also other drugs for newly emerging diseases or other specific diseases. And in the more particular context of Thailand's cooperation to combat COVID-19, Thailand offers appropriate technology that is suitable and affordable for the development context of our developing friends. We didn't exhaust our capacities to support our partners with anything unnecessarily fancy. Well, a series of medical consultation that I mentioned was simply organized with the basic IT communication devices. I mean, who could have thought that a smartphone or a laptop with basic function to join Zoom meetings would be able to save people's lives?
Yeah.
Yeah, and in addition to that, the medical equipment we supplied, such as RT-PCR laboratory equipment package that I told you before, is actually at 1/10 of the cost of a laboratory in some countries with higher technology infrastructure. And our RT-PCR package can still do the work needed as effectively, not to mention how easily it is to set up for emergency response.
And what is the impact and value of the cooperation in health sector with other developing countries, and how this cooperation contributes to the achievement of sustainable development goals?
Well, Thailand's development cooperation has been emphasized and the promotion of self-help efforts of other developing countries by enhancing capacity of human resources of development partners. The major impact and value of this cooperation with empirical evidences is that we really equipped our partners with knowledge in their heads and materials in their hands to save uncountable numbers of lives in their very own countries. I believe the COVID-19 pandemic serves as a wake-up call to the importance of international cooperation. While countries around the world have resorted to these unprecedented measures, including closing borders, hoping to avoid the virus' immediate devastation. A virus, on the other hand, knows no borders. No one is safe alone. But if your neighbors are safe, you are too. And this global pandemic has been taking too many lives and posing so many challenges to our societies. And it is only sensible for all countries to gain solidarity and fight against this combat together. And TICA's cooperation in health during the era of COVID-19 has just proved that in order to achieve the United Nations Sustainable Development Goals, the SDGs, we have to revitalize the global partnership for sustainable development and strengthen our partners' means of implementation. TICA have been and will keep continuing to drive international development cooperation with the most practical, applicable, and sustainable solutions based on good management of resources and expertise to contribute to the well-being of the global community and leave no one behind.
All right, and thanks for joining me in this program on the topic of the TICAs development diplomacy in public health during the COVID-19 era. Thank you, คุณชนิดนาถ
Thank you so much, Ka.
That was คุณชนิดนาถ ญาณกิติกุล Attaché to the Thailand International Cooperation Agency or TICA. And don't forget to follow the YouTube channel MFA Thailand and Facebook page FM88 Radio Thailand English and Radio Thailand World Service for more updates. And time to say goodbye, so please stay tuned on the next episode of MFA Update. I am Kimmy or Kim Paniknitha Grailerk.See you again until next time. สวัสดีค่ะ
MFA Updates